Coming to edema, edema is nothing but it is an fluid transudate or otherwise fluid exudate, that is the escape of the fluid, interstitial fluid into the extracellular spaces and result in the formation of abnormal mass, and this mass is nothing but edema, and it can also be termed as dropsy or otherwise known as hydropsy. It clinically we see that it manifests as swelling because there's abnormal accumulation of the fluid within the interstitial space, that is just beneath the skin, and this accumulation might result in a swelling, as we can observe it in the picture. Patient showing swelling just beneath the eye as well as at the angle of the eye. And this abnormality of the accumulation of this interstitial fluid, it is usually based on the balance of the fluid hemostasis as well as on the increased secretion, or otherwise when there's any impaired removal of the fluid, this might result in abnormal accumulation of this fluid within the interstitial space and result in edema. Coming to the pathogenesis, usually there are many contributing factors. Among them, 6 are most commonly contributing factors which we see for this edema formation. Usually we see that there's hydrostatic pressure, and this hydrostatic pressure, it is a pressure which is being maintained within the blood as well as within the blood vessels, where we see in the interstitial space that the passage of fluid or the exchange of fluids between the blood and the plasma, we see this is being maintained by this hydrostatic pressure. But then when there's alteration in the hydrostatic pressure, that when this is increased, it might result in abnormal escape of the interstitial fluid within the interstitial space from the blood vessels and might result in edema. Other than that, we also see then there's alteration in the colloidal or otherwise the oncotic pressure within the blood vessels. That is when we see then there's alteration in the pressure within the blood vessels, that is the proteins which are being present within the blood vessels, usually they exert the pressure for the exchange of the fluid between the blood vessel as well as between the interstitial space or the extracellular space. When this is being altered, that is when the plasma proteins are being decreased in quantity, they might exert decreased pressure, because of which there's abnormal accumulation of this fluid within the extracellular space, and rather it is not being moved into the blood vessel, and because of which this results in edema, that is because of abnormal accumulation of the interstitial fluid within this interstitial space and results in edema. It might also be because of an increase in the tissue colloidal or oncotic pressure, as pressure within the tissues or the extracellular space, extracellular tissue spaces is being maintained by the plasma proteins. When this plasma protein levels are being increased in conditions like a hyperproteinemia, this hyperproteinemia might in turn cause the increase in the tissue colloidal or oncotic pressure, and they prevent the escape of fluid into the blood vessel, and this fluid is being maintained within the interstitial place and causes the edema. Coming to the blood vessel permeability, when the blood vessel permeability is being increased, so since blood vessels they serve in transport of the fluid to the extracellular spaces, so when there's increase in the blood vessel permeability, it might also result in escape of this fluid into the intracellular spaces or the interstitial tissue, and this might result in accumulation of the interstitial fluid as well. Coming to the obstructions of the fluid clearance in the lymphatic system, as we know, the lymphatics they help in draining away the fluid into the interstitial space through this intracellular spaces. So when there's any obstruction, it might result in the accumulation and further cause the accumulation of this fluid and result in swelling of the swelling, and nothing but result in edema. Coming to the changes in water retaining properties of tissues themselves, we see that here, since water retention is being brought about in the kidneys in exchange for that of the sodium, which is being maintained by the intrinsic renal system as well as by the extrinsic renal system. So when there's any alteration in the kidney, such as in increased pressure within the kidney also can be seen within these portal veins. This might also result in the alteration of this fluid exchange for that of this sodium, and because of which there will be accumulation, and this results in edema. So these are the pathogenic mechanisms which underlie the formation of edema or accumulation of fluid underlying the tissue. Coming to the types of edema, clinically we observe there are few types of edema, where we see the first one is cutaneous pitting edema. That is, we see just beneath the skin, we see that there's edema, and this edema, when the pressure is being applied to the area which is being exposed to this edema, there is depression which is being formed on application of pressure, and once the pressure is being removed, this depression it rebounds itself and comes to a normal position. This is known as pitting edema, and when it is seen associated with the cutaneous tissues, it is known as pitting edema. When it is seen associated with the extremities, then it is known as peripheral pitting edema. And non-pitting edema is an edema where we see, even in spite of application of pressure to the area of edematous tissue, there is no depression which is being formed. Then this condition is known as non-pitting edema. Some conditions might show that entire systemic edema can be seen. That is, the generalized body shows to have this kind of swelling, where we see in conditions of chronic renal failure could also be one of the reason, since there is alteration in the glomerular filtration rate, where we see generalized edema of the patient who is suffering from such type of conditions. Coming to organ-specific conditions, where we see in cases of particular organs are only being affected with this edema formation, and amongst them we see edema. It could be either localized, that is, it could be either localized to one particular organ, where we see edema localized to the tongue in the picture, and it could be generalized, where the entire body can also be seen. And based on the composition within this edematous fluid, it can be classified into transudate and exudate. Coming to the distinguishing features between the transudate and exudate, transudate, it can be defined as it is a filtrate of the blood plasma without any changes in the endothelial permeability. Whereas exudate, it can be defined as it is a filtrate which shows the abnormalities or changes in the endothelial or vascular permeability, where we see that there is increased in the vascular permeability. Coming to the characteristic features of transudate, it is usually a non-inflammatory type, whereas exudate is an inflammatory type edema. And coming to the protein content, usually we see transudate, it is a low type of protein content which we can see, which might measure less than 1 gram per deciliter, and mainly it consists of this protein which is in the transudate. It is mainly the albumin and the low fibrinogen. And usually we see the protein content within the transudate, it is the albumin as well as the low fibrinogen. Whereas in the exudate, we see that there is a protein content is too high, which measures 2 to 2.5 milligrams per deciliter, grams per deciliter, and they usually contain increase in the fibrinogen content as well as in the other coagulation factors can also be seen. Coming to the other content of this edema fluid, this is the glucose content. We see the transudate, it shows same as that of the plasma, since it is of non-inflammatory in nature, whereas in exudate, since it's of inflammatory in origin, we see it consists of a low glucose content, which is usually measures 60 milligrams per deciliter. Coming to the specific gravity, since the protein content is low, we see a specific gravity is also low, and it is usually less than 1.015, whereas in exudate, we see, since the protein content is high here, we see it is specific gravity is also high, which is more than 1.1018. Coming to the pH content, it is usually alkaline. The transudate is alkaline in nature, which shows a pH of greater than 7.3, whereas in exudate it shows less than 7.3, so it is usually acidic in nature. Coming to the lipid density, low density high lipid proteins, we see that the lipid content, it is usually low density lipids are usually low here in transudate, whereas in exudate we see it as high. Coming to the ratio of the low density with that of the low density lipid molecules with that of the serum ratio, it is usually less than 0.6 in transudate, where it is more than 0.6 in exudate. Coming to the cells, in transudate usually we find there's only, it is less in cellular content when compared to the exudate, and among the cellular content, transudate consists of the mesothelial cells as well as that of the cellular debris, whereas as exudate is of inflammatory origin, it also consists of inflammatory cells other than that of the parenchymal cells. Coming to the examples of transudate, usually we see in cases of congestive cardiac failures, whereas exudate it is seen in case of inflammatory conditions or chronic inflammatory conditions where there is purulent discharge in kinds of purulent exudate which appears in the form of pus. So these are the differences between the transudate and exudate. Coming to a type of edema known as pulmonary edema. Usually we find in this pulmonary edema, usually the etiopathogenesis is most commonly because of the alteration in the hypertension which is present within the lungs. When there is increase in the pulmonary hypertension, this might result in increase in the alteration of the fluid within the lungs, and this will cause the hemodynamic edema and this will result in turn elevation of the pulmonary hydrostatic pressure. And when there is also alteration in the vascular permeability, that is when there is increase in the vascular permeability, this might cause increase in the accumulation of the fluid and result in the formation of irritant edema. And the other reason why the pulmonary edema occurs, it can also be because of the altitude changes. When the patient is exposed to the high atmospheric pressure, it might result in high altitude edema, which could also be one of the reasons for edema to occur in pulmonary region. Coming to the renal edema, usually we see it is seen both in the nephrotic condition, nephrotic syndrome, as well as in the nephritic syndrome. In the nephrotic syndrome, usually we see hypoalbuminemia, that is decrease in the albumin protein content, which might cause the alteration in the hypertension which is within the kidney, and this might result in the nephrotic syndrome and the nephrotic edema as well. Whereas in the nephritic syndrome, we see that there is alteration when there is it is most commonly associated with conditions known as glomerulonephritis, because of which there is alteration in the filtration rate in exchange with that of the sodium reabsorption, because of which there is increased water reabsorption or escape prevention of this water fluid escape into the extracellular space, and because of which it might result in nephritic edema and result in nephritic syndrome. When it involves the cardiac tissue, edema involving the cardiac tissue because of the alteration in the vasculature, vascular permeability, this might also result in abnormal accumulation of the fluid within the heart, and it might result in enlargement of the heart, and this condition is known as cardiac edema. When it involves the cerebral edema, that is in the brain, swelling in the brain is nothing but cerebral edema. It could be either of vasogenic edema, that is the vasculature within the brain might show alterations and might cause the accumulation of this fluid and result in vasogenic edema. When there is abnormal accumulation of the toxic gases which have been reached to the brain, and this might be toxic to the tissues, and this tissues might show an altered nature, might show an abnormality to this reaction to this toxic gases. This might also cause the abnormal accumulation of the water and result in cytotoxic edema. Coming to the interstitial edema, when there is alteration in the tissue or colloidal oncotic pressure, that is when it is raised, it might result in accumulation of this fluid within this interstitial spaces and might result in interstitial edema within the brain. Coming to the hepatic edema in the liver, usually we see when there is any portal hypertension within the veins, that is within the portal vein, it might also result in hepatic edema. Coming to the nutritional edema, usually we see in disorders such as kwashiorkor and marasmus because of the abnormality in the insufficient intake of the protein and the minerals. It might result in abnormal accumulation of the fluids and might result in nutritional edema. Coming to myxoedema, which is usually a consequence of hypothyroidism, where we see swelling associated with that of the skin of the face, and this condition is known as myxoedema. So these are the types of edema we see associated with particular organs.